I'm going to turn to our witness, the Secretary of Health and Human Services, Robert F. Kennedy, Jr. And Mr. Kennedy, Mr. Secretary, you may make your opening statement at this time.
Thank you, Chairman Crapo, and thank you, Ranking Member Wyden, for the invitation to appear before the committee today. Before I summarize what we've accomplished this year at HHS, I want to express my deepest condolence to the family of DeKalb County Police Officer David Rose, who gave his life to stop the gunfire attack on the CDC on August 8th. Officer Rose was a veteran. He was a husband and the father of 2 children. Officer Rose's widow, whom I visited, is expecting their 3rd child. I'd like Officer Rose's family to know that he remains in our prayers and that he will continue to be in our thoughts. Let me start with the big picture. Under President Trump's leadership, we at HHS are enacting a once-in-a-generation shift from a sick care system to a true healthcare system that tackles the root causes of chronic disease. Chronic diseases reach crisis proportions in our country. And finally, we have an administration that is taking action. The MAHA report assessment, which the White House released in May, was the first government analysis of the key drivers of childhood chronic disease: ultra-processed foods, chemical exposures, physical inactivity, and over-medicalization. This month, we will follow with the MAHA report strategy, the Trump administration's solution for addressing each cause. At HHS, we haven't just been writing reports. We have been the busiest, most proactive administration in HHS history. In just half a year, we've taken on food dyes, baby formula contamination, the grass loophole, fluoride in our drinking water, gas station heroin, electronic cigarettes, drug prices, prior authorization, information blocking.
The committee will come to order. I apologize to you for that outburst, Secretary Kennedy. I would notify everyone else in the audience. Comments from the audience are inappropriate. If there are any further disruptions, the committee will recess until the police can restore order. Mr. Secretary, please proceed.
As I was saying, prior authorization, information blocking, and healthcare interoperability. We're ending gain-of-function research, child mutilation, and reducing animal testing. We are addressing cell phone use in schools, excessive screen time for youth, the lack of nutrition education in our medical schools, sickle cell anemia, hepatitis C, the East Palestine chemical spill, and many, many others. At FDA, we are now on track to approve more drugs this year than at any time in history. I'm also proud to say that HHS under President Trump is doing more with less. We have taken measures to fight waste, fraud, and abuse. Just by eliminating duplicative enrollments in CMS, we are saving taxpayers $14 billion a year. Meanwhile, we are expanding access for people who need it. We are ending racist, diversity, equity, and inclusion practices and instead focusing on aiding low-income and vulnerable families, regardless of their race, which was the original intent of Title X. We're also pouring $1 billion into Head Start and the Administration for Children and Families. Compassion need not be the casualty of efficiency. I'd like to highlight some issues that have not gotten media attention. First, we are doing our part to fulfill the President's commitment to stop human trafficking, especially of children. We inherited a terrible humanitarian crisis from the previous administration with its open border policies, which allowed the appalling loss of 476,000 unaccompanied children. We have implemented policies now to ensure that that appalling tragedy can never happen again. We have knocked on 82,000 doors and located 22,000 of those children. I promise you that we will do more in the next 3 years. We are also addressing the disastrous health conditions in tribal communities on Native American reservations. I've met face-to-face with tribal leaders in dozens of communities and tribes in Alaska, Arizona, Idaho, New Mexico, and elsewhere. And I look forward to making HHS resources more available to those communities. One of the most significant initiatives under President Trump is the Rural Health Transformation Fund, part of the president's big, beautiful bill, which will provide the greatest investment of federal money into rural health care in history. Finally, I would like to address the recent shakeups at CDC. These changes were absolutely necessary adjustments to restore the agency to its role as the world's gold standard public health agency with the central mission of protecting Americans from infectious disease. CDC failed that responsibility miserably during COVID, when its disastrous and nonsensical policies destroyed small businesses, violated civil liberties, closed our schools, caused generational damage in doing so, massed infants with no science, and heightened economic inequality. And yet all those oppressive and unscientific interventions failed to do anything about the disease itself. America is home to 4.2% of the world's population, yet we had nearly 20% of the COVID deaths. We literally did worse than any country in the world. And the people at CDC who oversaw that process, who put masks on our children, who closed our schools, are the people who will be leaving. And that's why we need bold, competent, and creative new leadership at CDC. People able and willing to chart a new course. As my father once said, progress is a nice word, but change is its motivator, and change has its enemies. That's why we need new blood at CDC. That's also why it's imperative that we remove officials with conflicts of interest and catastrophically bad judgment and political agendas. We need unbiased, politics-free, transparent, evidence-based science in the public interest. Those are the guiding principles behind the changes at the CDC, and that is what you can expect all across our agency for the next 3 years.